Hi, my name is Annette Cody. I am a registered nurse currently working as an MDRO MRSA coordinator in infection control. This video presents information on one of the most dangerous threats to patient safety in the healthcare setting, Clostridium difficile. The intended audience for this video is all healthcare professionals and providers, as protecting our patients and preventing the transmission of Clostridium difficile is everyone's responsibility. The learning objectives for this video include identifying what Clostridium difficile is, identifying what the risk factors for Clostridium difficile infection are, identifying what the causes of Clostridium difficile infection are, identifying how C. difficile infection is diagnosed, identifying the recommended treatment of Clostridium difficile infection, and how to prevent the spread and transmission of Clostridium difficile infection. Clostridium difficile in the healthcare setting is also known as C. difficile, C. diff, Clostridium difficile associated diarrhea or disease, CDAD, or Clostridium difficile infection, CDI. What is Clostridium difficile? Clostridium difficile is an anaerobic, gram-positive, spore-forming bacterium that is non-invasive and produces toxins A and B that can cause disease. C. difficile bacteria are found throughout the environment in soil, air, water, human and animal feces, and food products. Some people carry the bacteria in their large intestines and don't have any ill effects. The intestines contain millions of bacteria, many which protect the body from infection. When antibiotics are taken, they can destroy some of the healthy bacteria found in the normal flora. Without this healthy bacteria, C. difficile bacteria can quickly grow out of control. Once C. difficile is established in the intestine, it produces toxins that attack the intestine lining. The toxins destroy cells and produce patches of inflammatory cells and decaying cellular debris inside the colon, which cause the symptoms of CDI, including diarrhea, fever, belly pain, loss of appetite, and nausea. This is an image of C. difficile in the large intestine. What are the risk factors for Clostridium difficile infection? C. difficile infection is most commonly associated with healthcare, occurring in hospitals and other healthcare facilities where a higher percentage of people carry the bacteria. Studies have shown increasing rates of community-associated C. difficile infection as well. Illness from a C. difficile infection most commonly affects older adults in hospitals or in long-term care facilities and typically occurs after use of antibiotic medications. Use of antibiotics, currently taking or having recently taken antibiotics, taking broad-spectrum antibiotics that target a wide range of bacteria, or using multiple antibiotics, or using antibiotics for a long period of time are the risks associated with antibiotics. Use of medications to reduce stomach acid, including proton pump inhibitors, will put a patient at risk for C. difficile infection. Comorbid conditions, including gastrointestinal surgery, inflammatory bowel disease, colorectal cancer, having a weakened immune system from other serious illness, staying in a healthcare facility where germs are spread easily, antibiotic use is common, and people are vulnerable to infection, being on nasogastric tube feeding, having a prolonged hospital stay, and having a history of previous Clostridium difficile infection also put the patients at risk of Clostridium difficile infection. What causes CDI? Clostridium difficile bacteria produces spores that are passed in feces and spread to food, surfaces, and other objects when people who are infected don't wash their hands thoroughly. The spores can live outside the body for weeks or months and can be found on many items in the hospital environment, including bed rails, linens, bathroom fixtures, and medical equipment. C. diff spores on items in the environment can be picked up and spread on the hands of patients, families, or friends and healthcare workers when items are touched. Illness can occur if these spores are unknowingly eaten or swallowed. How is Clostridium difficile diagnosed? Clostridium difficile is diagnosed through testing of stool for the presence of toxins. PCR testing is the gold standard for diagnostic testing for CDI. Testing is recommended in patients who have had 3 loose stools in a 24-hour period. It is not recommended that stool be retested after initial treatment. Sometimes physicians will test for C. difficile using sigmoidoscopy or colonoscopy to detect the presence of patches of yellow or white tissue in the colon. When there is concern of complication of C. difficile infection, the CT scan can show thickening of the wall of the colon, which is common in pseudomembranous colitis. How is CDI treated? The first step in treating C. difficile infection is to discontinue the antibiotic that triggered the infection. Doctors usually prescribe antibiotics such as metrodiazonal, vancomycin, or fidaxomicin. These antibiotics keep CDI from growing, which allows normal bacteria to flourish again in the intestine. Some patients will have a second bout of diarrhea that may respond to a second course of treatment. If unresponsive to antibiotic treatment, fecal transplantation as a last resort for repopulation is often recommended. How to stop the spread of C. difficile infection? To prevent the spread and transmission of C. difficile infections, hospital and other healthcare facilities follow strict infection control guidelines. Contact isolation, use of personal protective equipment including gloves and gowns, hand washing with soap and water, and special cleaning by environmental services of hospital room and equipment. Healthcare workers should practice good hand hygiene before and after treating each person in their care. Using soap and water is the choice for hand hygiene because alcohol-based hand sanitizers do not effectively destroy C. difficile spores. All surfaces should be carefully disinfected with a product that contains chlorine bleach. C. difficile spores can survive routine cleaning that doesn't include bleach. This slide serves as a visualization of the content on the previous slide, which talked about contact isolations, the use of bleach products, and the importance of hand hygiene in the fight against Clostridium difficile infection. Upon discharge from the healthcare facility, patient education should include continuing on the C. diff medication as prescribed, hand washing with soap and water, especially after using the bathroom or preparing food, having family members and friends wash their hands often, keeping the home environment clean, especially the bathroom, and notifying your doctor if diarrhea returns or increases. There are many resources available for information on Clostridium difficile. A few used for this video included the CDC, Center for Disease Control, the American Gastroenterology Journal, and the Mayo Clinic website. I hope you have found the information in this video helpful. We can all prevent the spread and transmission of Clostridium difficile through the use of enhanced contact precautions. Thank you.